Before diving specifically into payer-to-payer data exchange, it's helpful to take a quick step back and discuss the CMS interoperability and prior authorization final rule, which payer-to-payer sits under. So this final rule, it's known as CMS 0057, or more commonly as the quote unquote interop rule. But it's a government regulation which was finalized just about this time last year, actually, and it builds on the foundation set forth in the patient access rule. That really was the first rule to establish under the 20th Century Cures Act. Um, FHIR as a data standard of adoption to really improve and drive data interoperability between providers and health plans with the ultimate goal to improve patient care. And this interop rule states that by January 1st, 2027, which is going to come much faster than we all think, it will be mandatory for all affected payers, and that includes Medicare, Medicaid, and exchange plans, to implement FHIR application programming interfaces, or APIs. And there's specifically 4 APIs included in this rule. The first one, payer-to-payer API, and that's for member data sharing between health plans. Second is a prior authorization API to really drive transparency and efficiency. Third is a provider access API for care coordination. And lastly, the patient access API for data accessibility. So that's kind of at a high level, a little bit of an overview around the prior authorization final rule, the interrupt final rule. But to specifically dig into payer-to-payer, with the final ruling, impacted payers are required by January 1st, 2027 to implement and maintain payer-to-payer APIs to exchange clinical, claims, and authorization data when a member moves between health plans. And so, I just gave you a lot of details, but what does that exactly mean? Why whoever is listening to us today should they care? And I always think it's helpful to talk through an example and make it a little more real. So let me ask you, Matt, on average, how many times have you changed health plans over the
Uh,
course of your career?
I would say every time I've changed a job, but I do get offered
Mhm.
that, within jobs, as the employer changes health plans. But I would say every time I've moved on from a job.
And would you value, as you change jobs, having your new health plan know all of your medical history, all of your healthcare information that kinda has preceded you and been collected by your prior health plan?
Yeah, for multiple reasons, I think I would like to have that. Not just
Yeah.
administrator, but the fact that, of being able to my data to move along with me, would be, kind of comforting, rather than it lingering out in an organization I don't interact with anymore.
Absolutely, and that is really the intent around the payer-to-payer mandate is as a member moves from an old health plan to a new health plan, should they give approval for their new health plan to reach back out to their old health plan and gather all of that information, and I can give you a really quick example too. It was incredibly frustrating for me about 5 years ago. I had just changed jobs and recently had also just delivered my first child, and I had to have some post follow-up care, and, I went to the new doctor, and they were asking for all of my historical information. I was in the middle of going through a prior authorization, and I was just thinking, "Why am I the one having to actually go out and go back to my old provider and reach for all of this information?" All of this information is really should be more seamlessly exchanged across healthcare providers, across health plans. And that's really the intent around the interoperability final rule. It's intended to be a foundation to really help accelerate and push the industry towards more common data sharing practices across the entire healthcare ecosystem.